Sawadee Krap, good afternoon once again. Wednesday, the 12th of January 2022 today. And thank you to Dr. Sumani for the briefing in Thai just now. Of course, she mentioned very important issues and certain numbers and the situation as a whole, which I'll recap parts of that for you. The strategy, of course, is to continue to slower the pace of the spread of COVID-19 in the country. And that being said, individual discipline and the various measures that we have put in place continues to be very, very important. Dr. Sumani also talked about children, students, wherein around over 95% of students in Thailand in the elementary level and up have already received their first dose of the vaccine, which is very good news. Now for the booster dose, for the Pfizer vaccine in particular, she distinguished between the two types, the orange cap and the purple cap, wherein the orange capped Pfizer will be used for children under 12 years old, while the purple one will be used for older children above 12 years old. So that was a difference in the Pfizer formula that she elaborated on in terms of using that for children in Thailand. Now, I have to recap an important issue, clarification on the test and go scheme, latest update on the entry into Thailand. I'll recap this briefly because it will be, of course, of interest to the international travelers coming into Thailand. So firstly, the new registration under the test and go scheme, as you know, has been suspended indefinitely. New registration, indefinite suspension, subject to further assessment of the outbreak. And those who have already received their QR codes prior for traveling into Thailand can still do so as per their approved schedule. Now, just to reiterate once again, the latest update on the entry into Thailand is that entry continues to be permitted. Entry continues to be permitted for those who already hold the Thailand Pass QR codes prior until further notice. The situation continues to be monitored on a daily basis. So, of course, this is good news for those who are planning to travel to Thailand next week or in the latter half of the month of January. I'll move on to the vaccination progress. Firstly, start with the updates on the general vaccination scheme for the whole country. Yesterday, administered 513,208 doses of vaccines, increasing the cumulative number to over 107 million doses. We have over 49,000 receiving their first jabs yesterday, and over 133,000 receiving their second jab, while 330,000 with their booster dose. This means that 71.6% of the population have received their first dose, and 65.3% have been vaccinated with two doses. On the general situation, new confirmed case, we have 7,681 recorded as compared to the new recoveries at 3,350. Active cases, unfortunately, this continues to climb up in the past days and week. Active cases being treated remains at 66,286, as you can see on screen, of which 480 are in critical condition. Unfortunately, we recorded 19 fatalities. And continuing on with the updated guidelines on the treatment and management of COVID-19 patients. Now, this was an issue that was raised on social media. So I'll recap this for the English language audience here. The treatment and management, there's a flow chart, sort of like a mind map on screen there for you, which will be available on social media, perhaps in the Facebook page of the Public Relations Department in due course as well. So take a look at this flow chart, and I'll explain it briefly here. So just two cases. Firstly is in case there is a positive result from the ATK. And second case is in case there is a negative result from the ATK. So first, positive result. If you are a person under investigation or PUI with a positive result of the ATK test, first thing is contact the National Health Security Office. The hotline number is 1330, and there will be officials on standby to help give advice and assess the symptoms level. Patients with no to mild symptoms and no other risk factors, such as congenital diseases, can opt to undergo home isolation or community isolation, in which officials will follow, inquire, and look after the symptoms constantly, as well as providing medicine and other necessities until recovered. In this case, the policy is implemented based on the fact that most people who have been diagnosed with Omicron variant usually have mild or no symptoms. This is due to the high vaccination rate in the country. And they do not need to undergo treatment at the hospital, as well as to preserve the capacity of the public health system for critical cases. However, if symptoms worsen during home isolation or community isolation, officials will immediately transfer patients to the hospital so they can receive proper medical attention. And subsequently, those with positive results from ATK with symptoms or risk factors such as underlying medical conditions are to be sent to hospitals for treatment. The criteria for which is as follows: fever exceeding 39 Celsius for more than 24 hours, for adults having rapid breathing of 25 times or more per minute, low blood oxygen level less than 94%, or belonging to high-risk groups with underlying conditions, and for children, difficulty in breathing, drowsiness, lesser intake of food or milk. So also you have on screen here for you what to do during home isolation. You can find that. So that was for the positive result case. Now for the flowchart, self-ATK with a negative result, in case of a negative result, there will be further consideration of the issue of having symptoms or not. If symptoms are present, repeat with a PCR test. That would be required to check the results once again. However, if there are still no symptoms present, it's necessary to consider risk from past contacts as well. So if there is a history of close contact in high-risk areas, self-quarantine and ATK self-check every 3 days when symptoms are present would be required. So it's a term of a kind of a self-check procedure. If the results turn positive, contact the NHSO. And for those who are not in high-risk areas, self-quarantine is obviously not required, not mandatory, but it's required to follow the DMHT measures, which includes social distancing, wearing masks, washing hands, checking body temperature before entering different locations. So this is quite clear for the flowchart you see on screen for negative or positive results from the self-ATK test. Yes, so now moving on, just an important piece of news on the Health Ministry, having the government pharmaceutical organization expedite the import of ATKs, selling it at cost. Now, the Deputy Prime Minister and Public Health Minister, Anuthin Changwirakul, ordered the Government Pharmaceutical Organization, or GPO, to accelerate the procurement of the ATKs amid rising infections. And the NHSO, National Health Security Office, has meanwhile been urged to distribute the kits to risk groups as widely and as soon as possible. And according to the Health Minister, the Food and Drug Administration now allows the importation of ATKs from over 100 companies, provided the delivered batches pass the quality check, the quality standards currently in place. And also when asked how he would coordinate with the Commerce Ministry in controlling the price of ATKs, the minister had said to the media that prices would depend on the market mechanisms, and noting that the GPO has considerable purchasing power and prices have been steadily getting to become more affordable. The minister also said that given the rising demand of ATKs, he'll instruct the GPO to sell these kits at the cost for the benefit of the people. As an example, he said that if a kit was purchased at 30 baht, it should also be sold at 30 baht. Now, of course, in the market right now, you have different prices of ATKs. When I visited the pharmacy over the weekend, there were a variety of prices of ATKs. The one that I got was around 90 or 95 baht. So that's good progress in terms of the market mechanism and the pricing of a very important tool, a very important instrument in self-checking our conditions, whether we are positive or not after a risk event or hopefully not. So that's for self-checking through the antigen test kit ATKs in Thailand. So that's very, very good news. Just wanted to update you on that. So with that note, I thank you for your attention. We'll continue to have the press briefing in English and Thai on Mondays, Wednesdays, and Fridays throughout this month of January until further notice. Thank you for your attention. Please stay safe, and I will see you on Friday. สวัสดีครับ